Goni skill, shoulder abduction. Position the patient supine with the shoulder in external rotation and in 0 degrees of flexion and extension so that the palm of the hand faces anteriorly. Place the elbow in extension so that the tension in the long head of the triceps muscle does not limit the motion. Remember to test the unaffected limb first. In patient-appropriate language, ask the patient to abduct the shoulder. Assess the thorax for lateral flexion of the spine. The weight of the trunk may assist stabilization. Abduct the shoulder by moving the humerus laterally away from the patient's trunk. Maintain the extremity in external rotation and neutral flexion and extension during the motion. Stabilize the trunk to prevent lateral flexion of the spine. The end of shoulder complex range of motion occurs when resistance is felt and additional motion causes lateral flexion of the spine. Assess the infield of the joint. This is firm because of tension in the costoclavicular ligament, sternoclavicular joint capsule and ligaments, the latissimus dorsi, sternocostal fibers of the pectoralis major, and the rhomboid muscles. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer close to the anterior aspect of the acromial process. Align the stationary arm parallel to the midline of the anterior aspect of the sternum. Align the movable arm with the anterior midline of the humerus. Depending on the amount of abduction and external rotation that has occurred, the medial epicondyle may be a helpful reference. Ask the patient to perform abduction of the shoulder as done previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the trunk. Read the degrees of motion on the goniometer and then ask the patient to return the arm to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion, according to the American Association of Orthopedic Surgeons, is 180 degrees. Goni skill, shoulder adduction. Adduction is not usually measured and recorded because it is the return to the 0 starting position from full abduction.